Thank you, Sora Doni, for that beautiful prayer. On behalf of the Trenton Alumni Chapter of Delta Sigma Theta Sorority Incorporated, our social action and health and wellness committees would like to thank you for participating and joining us in our Let's Talk Maternal Health webinar. We will be covering important information and exciting information. So without further ado, I will send this over to Yasmin Minnelli. Thank you.
Thank you, Sora Regina. Thank you, Dr. Doni, and thank you, Chair Nita Winkle, and all of our participants who are here this evening. I am Yasmin Ali Gonzalez, the co-chair of the Social Action Committee of Delta Sigma Theta Sorority Incorporated. Today, we are honored to have several women a part of this important conversation to discuss some of the critical issues that continue to plague our community. We will begin with our Assemblywoman, Relina Reynolds Jackson of the 15th Legislative District. We thank you for being present this evening. We will follow up with a message from our First Lady, Mrs. Tammy Murphy, who will give us some words of her ideas and more details on the Maternal Health Innovation Center that is coming to the city of Trenton. We would also like to welcome our soror Linda Wyatt Simpson, as she will be introducing some of our panelists, Ms. Rosalie Boyer, and Director of Salvation and Justice, and also Ms. Rita Onetary, Director of Programming of Salvation and Social Justice as well. We would also like to welcome Ms. Bria Rodney, who is our doula, and Lisa Asari, who will also be speaking on the Maternal Health Innovation Authority. At this time, we would like to welcome our beautiful Assemblywoman and my soror, who I'm grateful that she was able to squeeze us into her schedule this evening to say a few words and give some remarks. Assemblywoman Relina Reynolds Jackson, you have the floor.
Good evening, everyone. I just want to say thank you. Thank you for the opportunity to bring you greetings from the 15th Legislative District, and I am Assemblywoman Relina Reynolds Jackson. You have all of my favorites on here. This is a very, very important topic that we're talking about, maternal health, and you have the best experts that I work with. And so, you know, when I talk about carry the torch, hold the torch high, these phenomenal people are doing just that. And they support me in the work around maternal health. They affirm the things that we think about when we say that the numbers, when you hear the statistics about moms and babies not making it past their first birthdays, these are all real things. We don't make these stories up, but we've moved past that and we're trying to bring real change to our communities. And so I want to say thank you to all the superstars that are on this call. May you take this information and take it back to the community, because we're talking amongst the choir right now, but it's valuable information and we really want to connect the dots. And as we look forward to Delta Days at the State House, I think the things that you're going to learn on this call is definitely going to be something that we want to advocate in the halls at the State House. So I say thank you again so much and have a great evening.
Thank you so much, Assemblywoman. At this time, soror Regina, we will have a message from our First Lady. So Regina.
1 second.
Oh, okay.
Okay, First Lady.
Sorry, 1 second.
Okay, First Lady.
Good evening to the ladies of Delta Sigma Theta. I really wish I could be with you in person, but I am so grateful to be able to share this message with all of you. And I want to thank Trenton City Councilwoman Yasmin Ellie Gonzalez and Assemblywoman Verlina Reynolds Jackson for the opportunity to be a part of tonight's program. For decades, Delta Sigma Theta's Trenton Alumni Chapter has played a critical role in educating the Mercer County community on both physical and mental health initiatives, beginning in the 1950s. Sources directly to the community who need them. The model we use for festivals and event series that we oversee through Nurture NJ, our statewide maternal and health. As you already know, he has been in a maternal health crisis for far too long. When Phil took office in 2018, New Jersey was appallingly 57th out of 50th, all 50 states for maternal mortality. Even more disturbing, this was primarily due to an extreme disparity in outcomes between mothers of cases. Black mother was nearly 7 times more likely than a white mother to die from pregnancy-related complications, and a Black baby was nearly 3 times more likely than a white baby to die before his or her first birth.
Okay. I don't know what went wrong with the video. Maybe that was an oversight. So we can possibly continue on. I don't know if Sora Regina dropped off. That may be her computer. And we could just continue on with the program. So we may jump ahead. Yeah, we're going to quick pivot right now. We're going to jump ahead and just move forward with the program. And I would like to introduce Ms. Lisa Asari, who is the CEO of New Jersey Maternal Health Innovation Authority, who can also give us some words and describe what is going on and the plans for the Innovation Center that is coming to the city of Trenton, New Jersey. Ms. Lisa? Ms. Lisa?
To ensure our doulas are culturally competent. We also established the first in the nation Maternal and Infant Health Innovation Authority, and we are building a groundbreaking maternal and infant health innovation center in Trenton to continue this important work past our administration. Importantly, we have worked closely with our partners at the John S. Watson Institute at Kane University on a 2-year community engagement process to ensure that the Trenton community voices and most importantly, the mothers who will be served by the center guide its creation. 2 more of our most recent and transformative achievements are the launch of our Universal Newborn Nurse Home Visitation Program and our Doula Access Bill. Together, these policies work to target the most critical period for complications: labor, delivery, and the first few weeks postpartum. Our Doula Access Bill ensures that every mother has the right to have a doula present in her delivery room at every birthing hospital in the state. The support of a doula is proven to reduce birth complications, lower C-section rates, improve maternal mental health, and so much more. Quite frankly, if I had known doulas existed when I was pregnant with my 4 children, I absolutely would have had one. Similarly, our Universal Newborn Nurse Home Visitation Program, known as Family Connects NJ, supports mothers during the most vulnerable postpartum period. This program is available to every single new parent in the state, including those who have experienced the tragedy of stillbirth. It does not matter if you are undocumented. It doesn't matter if you have health insurance or not. This program is universally available, easy to access, and completely free. Through this program, a nurse comes to a new mother's home within 2 weeks of a newborn's arrival to ensure both mother and baby are thriving. The nurses can help with lactation, identifying any postpartum mental health issues, connecting parents with resources, and really so much more. And while we are incredibly hopeful for the potential of this program to save lives, I personally believe it can also make a world of difference for every new mother. Anyone who's experienced those first few days and weeks with a newborn can understand just how helpful it would be to hear from a nurse, "You're doing great, Mom." It's easy to sign up for a nurse home visit by accessing the Family Connects website at familyconnectsnj.org. And right now, the program has already launched in 5 counties across the state, including right here in Mercer County. So I hope you will help us spread the word about this groundbreaking and completely free program. We have much more work to do, but I am pleased to share that over the course of our administration, New Jersey's maternal health ranking has risen from 47th in the nation to 27th, and we continue to work toward our goal of becoming the most equitable and safest state in the country to deliver and raise a baby. There is no question that our progress thus far and our hope of reaching our goal depends on the collaboration of so many across our state, including all of you. I am so thankful for the support and partnership of Black-led community organizations like Delta Sigma Theta and particularly your Trenton alumni chapter. So whether it is through participating in doula training, promoting home visitation, or continuing to host informational sessions just like this evening, I really hope that you will continue to work together with us in partnership as we make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. Thank you.
Thank you, First Lady. We are going to now pivot and welcome in Ms. Lisa Asari. Hi, Lisa.
Unmute myself. Can you hear me? So let's unmute myself to start talking.
We can hear you.
Okay. Okay. Good evening, and thank you so much for having me. I'm having terrible technical difficulties, so I'm glad to be here with you, and I'm glad that you can hear me. I think I was having difficulty hearing First Lady Murphy, so I felt like I was going to be repeating some of the things that she said, but maybe you'll be hearing them for the first time. Hopefully, the technology will work with me. But I come to you and I bring you greetings from the Maternal Infant Health Innovation Authority. I have the great pleasure and actual honor of serving as its inaugural president and CEO. This is a big deal. This is a big deal for New Jersey. This is a big deal for our work. And you should know that this is the first and the only of its kind in the entire nation. And so this is a big deal for New Jersey, and it's a big deal for the city of Trenton. I personally have worked in government for 25 years. I have worked in maternal and infant health my entire career, and I have never seen so much attention and so much energy, rigor, and excitement around this issue as I've seen now. It's really a time that is unprecedented. And to have a champion such as First Lady Tammy Murphy is just the icing on the cake. She, with many of the legislators and administrators that are on this call, have really raised the bar on this issue. You know, I'm also a mother. I am a mother of 3 beautiful Black children, a 27-year-old girl, a 24-year-old boy, and a 15-year-old girl. So if you see me with gray hair, it's from the 15-year-old. And I had all 3 of them at Capitol Health. I had all 3 of them at Capitol Health when Capitol Health was in the city of Trenton. I actually lived in Camden County, so I had to drive from Camden County through Burlington County to get to Mercer County, to get to Capitol Health, to have these children. And people say to me, why did you do all of that? Like, you passed a couple hospitals along the way. Like, why did you think you needed to drive an hour to get to this hospital? I needed to get to the hospital because my OB-GYN was a Black woman that I trusted. I needed to get to this hospital because my OB-GYN was a sister who actually was my practitioner, who became my friend. And I trusted her, and I really felt that everything I shared with her, she listened to. And she listened to it so much that I think with my first child, she wasn't even the one on call. But because of the relationship that we had developed over the prenatal period, she felt compelled and called to stop what she was doing and get to Mercer Medical, Capitol Health, to deliver my baby. And I will forever be grateful. She ran in and she had a 2-year-old, and she had her 2-year-old with her, and she put her 2-year-old in the waiting room with a video on, and she came and took care of me. But that is just an illustration of what a beautiful birth can look like. And I was blessed and I was fortunate to have that. And then I went on to have 2 other kids, and she delivered the second one. And then by the time the third one came, I should have retired. She had retired. And I had a nurse midwife who delivered the third one. But I say that to you to say that this work is deeply personal for me. It's not just a job. It really is a life's calling and part of, I think, my mission. I had 3 healthy babies. I had 3 successful pregnancies. But not all women like me get that. You may have heard, or if you missed it, I think if you've heard it, I'm going to repeat it. But a Black woman is 7 times more likely to die from a pregnancy-related complication than her white counterparts. And a Black baby is 3 times less likely to make it to its first birthday than their white counterparts. And when I talk about the Black women and the pregnancy mortality, this is even when we control for things like income and education and socioeconomic status. So you must understand that a Black woman like me with a master's degree has a greater chance of mortality than a white woman with a high school diploma. And so we used to always think that things like education and income and socioeconomic status were very protective factors. But we see that with this, they don't protect us in ways that we would expect they would. And so I think it's always important to kind of start with the stats, to sort of start with who I am, to start with why I think this work is so important, and to, of course, start with thanking people who have helped raise the bar on this. People like First Lady Tammy Murphy, people like Assemblywoman Verlina Reynolds Jackson, and so many others. You know, they deserve our thanks because they are sounding the alarm on this issue in the State House, in places that I don't routinely get to. And so now that I've kind of painted the picture of what this looks like, what are we doing about it? What are we doing about it is the million-dollar question. We are doing so much. So this Maternal Infant Health Innovation Authority that I described when I first started speaking is the first and only of its kind in the nation. And it is a state authority fully committed to addressing maternal and infant health, but really looking at the disparities. You know, if you look at our numbers overall, they're not excellent, but they're not terrible. But when you look at our disparities, they're horrific. I mean, this is bad. We must do better. And Tammy Murphy has stated, we are looking to make New Jersey the safest and most equitable place to have a baby and to raise a child. So this authority that we have given the acronym MIA to, we call it MIA, M-I-H-I-A. You know, we're good in state government for coming up with acronyms. So I'm going to tell you now, you're going to hear me refer to MIA, and I'm talking about this authority. MIA is really designed to be the tent house that houses all things maternal and infant health. But MIA is designed to have impact on 4 different levels. So MIA is there to have impact at the local level, and we will do that through the Maternal Infant Health Innovation Center that is being built in the city of Trenton. You guys are from Mercer County, so it's coming to Trenton. The city of Trenton is where we're having this center. We've identified a site of land just adjacent from the Henry J. Austin Health Center and very close to Mount Zion AME Church. We have also chosen 3 anchor tenants. So it will be Capitol Health, who will help us with clinical services, the Rutgers School of Nursing and several other academic partners, and the Trenton Health Team. So that's the local influence of MIA. Then MIA is expected to have statewide influence. So we're not limiting our efforts to the city of Trenton. We plan to do work statewide. And we will do that through the Nurture NJ platform. You've heard of Nurture NJ, that is Tammy Murphy's strategic plan, her initiative around maternal and infant health. We will do that on the statewide level. And we're going to do it using this whole of government approach. Because as much as people want to think that healthy pregnancy and healthy babies are just about prenatal care, they're really not. They're about everything. They're about stress. They're about where you live. They're about the air that you breathe. They're about whether you have a job or not, whether you have a safe place to live, whether you have childcare, whether you have food. And so I say all of this to really tell you that we're doing this from a whole of government approach. We're not just limiting this to health or human services. We're really looking at economic development. How do we put money in people's pockets so they're less stressed out, and we hope will lead to better health outcomes? So I've talked to you a little bit about what we're doing on the local level and the state level, but we're also doing this on the national level. So New Jersey is being looked at by all of our counterparts across the nation. They are really excited about what we're doing in New Jersey, really excited about Nurture NJ, our strategic plan, excited about the MIA, Innovation Authority that I've talked about, excited about the center that we're building in the city of Trenton, just excited about the 66 pieces of legislation that we have passed. Assemblywoman Jackson has sponsored many of them on behalf of maternal and infant health. They're just really, really excited about what we're doing in New Jersey. So there are a lot of eyes that are looking at us nationally, and we are routinely called upon by other state agencies to provide technical assistance. How did you do this, New Jersey? Tell us how we can do this as well. So I see us as really playing a big role on the national stage. And the fourth and the last place that we are expected to have immense impact is on the global scale. Global scale, so outside of the United States of America, what can we teach other nations? And more importantly, what can we learn from them? Because we don't have all the answers. Some of the things that we are pushing have been around for time immemorial. Things like doulas. Doula is a Greek word, but there's doulas in Africa. There's doulas in the Caribbean. I mean, that's just how we do. That's how we roll. We look after our sisters. We look after each other. And so I think it's important to recognize that some of the things that seem new are really old. They're ancient traditions. They're the way that we cared for one another within our communities. So, I can't tell you how excited I am to step into this role, how excited I was to be asked to present to you, the Delta women of Mercer County. I love that you're interested in this work because we need you here. The last thing that I will say is that MIA is designed to be informed by community. So I don't sit in Trenton making these decisions by myself. I need you. I need you all as my thought partners. I need you all to push out the initiatives that we work so hard to develop into your communities. I think Verlina mentioned it. Assemblywoman Reynolds Jackson talked about, take this back to your communities. We need this information to get out. When we want to share information, we know how to share information. We know how to share good news. We know how to share bad news. But this is information that is life-saving information. Things like universal home visits, things like continuing to get WIC. WIC is not just for formula or for infant food, it's for kids up to the age of 5. Understanding that New Jersey Transit has a special program for pregnant women where you can get rides to appointments. I mean, these are things that I'm talking about that you may not know about. But I want you to know about these things. I want you to share them with the people you go to church with. I want you to share them with the folks in your neighborhood. I want you to help me push out this messaging. And I want you to give me feedback. about what you're hearing from the community. What is working? What is not working? Where we need to revisit things. I'm accessible. I'm available to you all. I see friends on this line. I see colleagues on this line. I see First Lady Boyer, who's a board member, a MIA board member. I see so many of you that I know personally. Let this be the beginning of many conversations. Invite me back. I will come. This platform is easy. As long as my connectivity works, I'm always with you. But I think it's really important that you feel a part of MIA and you feel that there's a place and a space to really share your comments, your concerns, your critiques even. I think we will be successful if we move forward together. And we're going to need all of us. We didn't get here overnight. I have to tell people we're not going to get out of here overnight, but we can plan strategically together on how we're going to get out of this, because we can, and we absolutely will make New Jersey the safest and most equitable place to have a baby and to raise that baby as well. So thank you so much for your time.
Thank you so much, Ms. Lisa. Now I'm going to turn it over to Soror Linda.
Good evening. I would also like to thank New Jersey and First Lady for her initiatives, but I want to let you all know that there is another initiative that is going on that's going to help Trenton with maternal health. So at this time, I would like to introduce my First Lady, Rosalie Boyer from Greater Mount Zion in the Salvation and Social Justice, as well as Retha Anatari, who both work very hard to make sure that our maternal health and birthing center will be ongoing and coming up. So at this time, I will turn it over to them so that they can share more information about that.
Good evening, everyone. It's such a pleasure to be here. And I always have to shout out the people's champion, Assemblywoman Verlina. Could never do it without her. She's just a champion, and Councilwoman Yasmin is a pleasure. And the Deltas, I made sure I didn't wear red today. I'm staying in my lane. So first, I just want to just ground us and just kind of give a little show a video that kind of it tells the story. So I just want to share my screen. Is everyone able to see my screen? Okay.
Somewhere
And
in
you can hear?
Africa's past,
You can
before
hear?
the guns, the shackles, kidnapping of storytellers, sky readers, musicians, dancers, doctors, sculptors, teachers, planters, hunters, historians, mothers, fathers, and children, they were the women who caught the babies and guided them into the world with their gentle hand. The history of Black midwifery dates back 403 years to when enslaved Africans were forced to arrive to America. African midwives were a subset of this population who brought their knowledge of women's reproductive health. Enslaved midwives were birthing everyone, both enslaved and white babies. As a result, many people proclaim that Black midwives birthed and nursed America. Black women dominated midwifery until approximately 1900, when anesthesia was introduced, which led to an increase in hospital birth rather than in-home birth. It became more profitable for America to birth its babies in hospitals. This was the first step away from midwifery. As medical practices transitioned, the requirement for Black midwives unfairly changed, and they were systematically forced out of midwifery. To increase hospital profit and increase control, many white male physicians began discrediting Black midwives. They promoted a narrative that these midwives were unsafe, unsanitary, and lacked training. These physicians stripped power from the same women who helped birth this nation. They undermined Black midwives' credibility and brought white public health nurses into the South to supervise them. As a result of these inequitable practices, Black midwives to this day are extremely underrepresented in the birthing space. Black midwives were forced even further to the margin in the 1930s when there was a rise of white midwives training in England and bringing a nursing midwifery model back to America. Many Black women were excluded from participating in this new model. The evolution of racial segregation and injustice in maternal health through the 20th century reflects the same injustices running rampant throughout all of American society. By the 1960s and 1970s, the effect of civil rights movement promoted a stronger impetus to get Black midwives into these training programs. To this day, of course, the irony giving Black women are pioneers in this space. As we honor our ancestors who were trailblazers in midwifery, it is also critical to uplift today's Black women who are fighting to reclaim birthing spaces. There is a dire need to reclaim our tradition, our legacy, and caring for our own people, the hallmark of midwifery in their acute attention and care when listening to people. When it comes to Black patients, who can listen to these sisters better than providers from our own community? Midwives play a critical role in hearing their voices. It is time to put Black maternal health Black in our hands.
Let me see now. Bed made fresh, newspaper bags ready. I wish to goodness all my mothers could have everything fixed up this nice. I'll have to move the bed over to get under that light. Baby tray fixed. Gonna move that table down this way to lay out my things. He even got the slop jar fixed on the paper. Oh, look at them pretty new shoes. Look like Tom done bought somebody a present. Let's see how you doing, Adam. You're fine, but it ain't no hurry. It weighs 8 1/4. I didn't miss my guess much.
Yeah, so thank you for giving us this time to be here, and thank you for allowing us to show that important video. And while I'm bringing up the next deck, I just want to take the opportunity to thank Lisa for inviting us. You know, we truly appreciate having this conversation. So let me pull up let me share again.
And so while First Lady Boyer is looking for the slide, I just wanted to again say my name is Rita Ornatiri. Thank you all for the invitation tonight. Really have to give a shout out to Assemblywoman Reynolds Jackson for all the great work that you're doing. You know, we love you, of course. Just wanted to also say thank you to all of the Greater Mount Zion members who are part of Delta Sigma Theta. We always start our meetings and any circles that we do by giving honor to our ancestors, right? It's very important for us to understand our history, and it's very important for us to understand whose shoulders we stand on and the struggles they had in the past. And so we wanted to start off by recognizing our ancestors. And let me also tell you that, you know, this is personal for me because about a couple years ago, I was looking through Ancestry.com, and I didn't know anything about my grandmother. And they happened to put up a hint, and that hint was a death certificate. And in that death certificate, I found out that my grandmother died at 28 years old from complications from pregnancy. And that was the first time anybody in my family actually knew what happened to her. My father was, I think he was like 2 years old when she passed away. And so it is very important to me to give homage to my grandmother. I think she probably directed me here to do this work, but to make sure that this doesn't continue in the future. And so,
yeah, and that's a good segue to now, the grounding was the video to show that this is not new for us, like Lisa said. You know, this is something that Black women have been doing from the beginning of time. And to honor that, we actually came up with our logo for our birthing center. Everyone can see my screen? Yeah. So we came up with our logo back in our hands, right? And you see the Sankofa bird, and you see the babies snuggled safely. Because again, we as Black women have to take it back in our hands. So just to give you how we're approaching this work, and I know Lisa and the First Lady, you know, talked a lot about what the stats look like and everything. The only thing that I would add to that is we've been doing this work a couple of years ago, and you can always research this. A couple of years ago, Black women were 4 times more likely to die in New Jersey. Black women now are 7 times more likely to die. So it's so important for us to actually, you know, we understand the data, we understand what the issue are. Now we have to provide solutions. And because we're, like Lisa said, because we're here in Trenton, we have the location, we have the facility for our birthing center. And our partnership is with Salvation and Social Justice. I'm the co-founder of Salvation and Social Justice, along with Reverend Dr. Charles Boyer, and Greater Mount Zion CDC. We're the pastor and first lady of Greater Mount, the greatest church in Trenton. I could do that plug. And so this is a partnership, and we have a partnership with Maternal Wellness, and that's Crystal Charlie, who will be the director for our birth center, and it's birth and maternal wellness. And it's important for us to provide services in this area, so that we make sure that women who live in proximity of you know, the birth center can walk to get services. And services is a holistic approach for us. Lisa said it when she said about, and I'm glad she shared that story when she talked about she traveled so far because she had a Black doctor. And I have the same sentiments. I have 2 children that I gave birth to, and I have a bonus son. I had Black doctors. And I had no issue with my birthing experience. And it is important for me that Black women have the same experience. So it's important for us to have a community of wellness, and we're calling it our maternal hub in this area, because it's important for us to have culturally congruent care. You know, is by Black women for Black women. Who can tell us better about our bodies than us? And I think we need to get to a place where, you know, doctors will see us as patients and not as a Black woman and treat us unfairly. So with that, I'll turn it over to Teresa to talk about the policy.
Yeah, before we move from here, I also wanted to mention that I actually also traveled 1 hour to get to a Black doctor when I had my children. I live in Monmouth County. I traveled to Plainfield for a Black doctor, and that hospital is no longer operating in Plainfield. So that we're in a crisis mode, and it's extremely important for us to take back our care into our own hands. Just wanted to mention that at our birthing center, in addition to birth, actually attending to clinical births, and that's for women who are not at risk. So we recognize that it's a small percentage, but we want to make sure that if you are at risk, you know, we're going to direct you, of course, to a hospital. But if there's no at-risk issues, then we're welcoming you into our birthing center. And in addition to birthing, we're also going to be able to provide doula services, midwifery services, lactation services, mental health care. And we're focusing on not just the family, not just the mother, but the entire family. So that's critical. What you saw in that video was love, right? So we want to just make sure that when a woman and her family have birth, which should be the most joyous time in your life, there should be love and care in the birthing center.
Right. And the 2 things, I'm glad you said it, the 2 things that we're addressing that we've heard continuously as an issue for Black women: 1, you're going to be heard, and 2, you're going to be seen. So I think that's important to raise up.
So we actually wear 2 hats. So we have the direct services, which is under the birthing center, and that's extremely important. And we want to make sure there's love. We want to make sure that there's it's culturally congruent. We want to make sure that we are addressing the social determinants of health. And the most important thing, of course, is we want to bring down, we want positive outcomes and bring down the current stats that we have.
Right.
But the other arm, in addition to doing direct services, is policy solution, right? Assemblywoman Reynolds Jackson know that in order to make some systemic changes, that you got to change policy, right? And so while we're doing work on the ground in Trenton, we also want to make sure that we're impacting policy across the state, because it's extremely important. So for Salvation and Social Justice, we have 3 legislative priorities. 1 is the Black Maternal Wellness and Birthing Hub, not just in Trenton, but really pushing to have pilot programs in other cities across New Jersey that are birthing deserts, right? We're not here just to do our little thing and not impact what's going on across the state. And so we're looking to looking at legislation and looking at policy that can really create these same kind of hubs in other places, and to give folks in their own community an opportunity to have a say about what's important for them in their own community. The second priority is to really look at workforce development around midwifery. because we have a shortage in Black midwives. We currently have a midwife that we are working with who is operating out of Philadelphia, although she's licensed in New Jersey, because there's such a shortage in midwifery. And it also is costly and it's timely.
Right.
And so often Black women can't take off and devote the time they need for the study that they need in order to be midwives. So we're looking to really push legislation that would have put a pilot program in place that will allow Black midwives to get the financial support they need and the technical support, clinical support that they need in order for them to be successful and to increase the number of midwives we have in New Jersey. Black midwives in particular. The third policy priority is a guaranteed income for pregnant Black women, right? And so we know that we really need to not just look at the superficial issues, but we need to look at every aspect, look at this holistically, right? And so we know that often Black women struggle financially in order to support themselves and their family. And that, I wanted to reiterate that this is not an economic issue.
Right.
All Black women are impacted, but we know that there's some Black women within our community that need a little bit of extra help. So we're looking at programs in California and Mississippi to model what they're doing around guaranteed income so that mothers starting in their second trimester will get a stipend on a monthly basis through 18 months so that they can feel comfortable and not have to worry about financial support for their children and their families. And so these are just 3 policy agendas that we're looking at. We definitely need the help of organizations like Delta Sigma Theta.
Right.
I always say that if you don't have money, you have to organize, right? If you don't have money, you need to have a block of people who are really fighting for you.
Right.
And so, we're looking for your support. Our policy director, Raquel Romas Henry, is available if you need any information about more details about the policy. But we're definitely are going to be calling on you to help support this moving forward.
Yeah.
Thank you.
So, so it shows the relationship between Salvation and Social Justice and Greater Mount Zion CDC. So we have, both organizations that's working collectively and collaboratively to make sure that we bring wellness to Black mothers in not only Trenton, but the state of New Jersey. Thank you for allowing us this opportunity to share presentation.
Thank you so much. We appreciate all of that knowledge and information that you share with us. It is very important. And as you mentioned, there are women who don't have great experiences, and this is a way that we can help make every woman have a beautiful experience when giving birth. To kind of come around to the next part of the program, we have our very own, our newest member of Delta Sigma Theta sorority, and also a doula, Ms. Rhea Rodney, who would also be sharing some great information with us. Ms. Rhea?
Hi, good evening. Thank you so much for having me. It is truly a pleasure to share this panel with the biggest leaders in our state when we're talking about maternal child health. So my name is Rhea Rodney. I am the director of Nurture NJ. I sit in the office of First Lady Tammy Murphy. I'm responsible for carrying out our strategic plan of making New Jersey the safest and most equitable place to have your baby and raise a family. I just want to say thank you to First Lady Boyer and Ms. Onateri. This was a perfect segue into, I'm going to be talking about doulas. So I'm really on fire about the work that you're doing, and I'm looking forward to the continued partnership and the strides that you're making, not just in our community, but across the state. I'll talk a little bit about myself. I am a registered nurse by training. I worked in postpartum, so after you have your baby, the nurse who takes care of you afterwards. And I also worked in the special baby nursery, often called the NICU. So if there were any complications with the baby, I took care of mom and baby. Prior to becoming a nurse, I am a doula by training. So I have worked as a doula. And the questions that I get are always, how'd you get here? What brought you to this type of work? And it's always a hard story to tell. I have friends who look like me, who have gone into the hospital to have their baby and had serious complications. And knowing that certain things that could have been avoided, I really needed to take action and start working in my community. So I became a doula. I was a doula before I became a registered nurse. So doula actually comes from the Greek word for mother's helper. You're literally a help to the mom and the family. We provide care during labor, but also postpartum and across the continuum. So if you could be a doula for the birth, you could be a postpartum doula, or you could be full spectrum and you provide prenatal education as well. Some of the questions I get are like, oh, do I need a doula? Do I need a midwife? What's the difference? A midwife is actually a medical professional. They're trained. They're your medical provider. And the doula, we're there for that holistic approach, that whole person in the environment. Some other questions are like hospital versus home birth. I just want to clear up, like, anyone could benefit from a doula. So sometimes people think, oh, I can't have a doula because I'm giving birth in a hospital. That's not true. And now under New Jersey legislation, as a doula, you can't be kept out of the hospital. You have the right to access a doula when you go to the hospital, have your baby. Or people might think medicated versus unmedicated. If I have a doula, I'm not going to be able to use medications. That's also not true. Again, we provide the holistic approach. So it's really what's best for mom, baby, and the family. And I want to emphasize, like, when I worked as a doula during my specialty, I worked with high risk families, right? So these are moms who knew that they were having a C-section going into the hospital because of the circumstances. That was what was best for them and their medical care, but they still benefited from that prenatal education, postpartum visits, those kind of follow-ups. So what do doulas actually do? What do we do? We provide continuous labor support. So we're there doing lots of coaching, training. We're trained to provide coaching, position you, move you around. If you have a baby, maybe some of this is resonating with you. We provide childbirth education, prenatal and postpartum. And there's a heavy push for cultural congruence, right? So what does that mean? Does your doula understand your background? I always say, if I need advice, I'm going to my mama, my granny, or the church. That's where I get my advice. And having a doula who is culturally congruent, they're going to understand that's where you get your advice. They're going to understand you. So it's important to ask those questions and lean on those things. Doulas do not conduct medical exams. We're not there to see how far you're progressing or anything like that. We don't make a medical diagnosis or administer any kind of medications. So I'll talk briefly about how to get started, right? So let's say this is something that resonates with you. You're really ready to move and take action. You're going to look for a training for New Jersey, right? So some of the questions you might ask is, does this doula training meet the New Jersey Family Care Certification requirements? Am I going to be paired with a mentor? Can I shadow someone for some hands-on training? You'll take a classroom class and then you'll get started. Your mentor will actually work with you to recruit clients, and the different things you learned in the classroom, you're going to apply them in the birth space. So you'll learn about the significance that doulas bring to the families, the hands-on techniques, lactation support, postpartum support, screening for mental health and wellness. And the research shows us less medical interventions and increased satisfaction when families have a doula. If you yourself have had a baby, or you've spoken with somebody who's had a baby, you might hear, oh, they did this, they did that, they moved, they did all this stuff to me. Like, there are fewer interventions when the doula is there. And I think what makes a doula so unique beyond your OB, your midwife, is we're there for the whole ride. So we do your prenatal plan. What does a great birth look like? We're there when you're giving birth, and then we go to your house. You're going to get a follow-up visit 2 to 3 days after you give birth. So it's really holistic. If you're ready to get started, I'm going to drop some links in the chat, but you're going to find a New Jersey training. You'll go through your training. And if you're interested, you can apply to be a Medicaid provider in the state of New Jersey. So you'll do your classroom training, you'll do your hands-on training. We also ask that you do some additional cultural competencies. We ask all of our doulas to do HIPAA, CPR, and fingerprinting, and then you submit your application to the state. And that can be anywhere from 30 to 90 days in the process, depending. So I just want to emphasize, we went through a lot of statistics and a lot of scary things, but there is certainly hope. I think like this conversation is one of many. I'm really excited about all the different partnerships that we've discussed this evening. And if you are ready to get started in doula training, I'm going to list some resources in the chat. But my challenge to you as we leave, right? Trenton makes, world takes. So let's make ourselves a leader. Let's make ourselves the person that the city that the whole world is watching. I'm very eager to grow our footprint of doulas right here. And I'm pushing for that cultural congruence, because when you show up as your authentic self, that is the greatest gift you will ever give to a family. We are going to reduce all of these scary statistics that we're talking about just by being present and advocating. So I thank you for your time. I will hand it over to Soror Bianca Taylor Davis and open for questions.
Hi, good evening, and thank you, Soria, for that plethora of information. We do have one question in the chat that asks, how many hours are in the classroom training?
Thank you. That is an excellent question. So currently, the state of New Jersey, if you wish to panel with Medicaid, we recognize 5 trainings, and the hours may vary by classroom. And that is just different techniques and different methodologies. So certain programs, they're going to lean more on that ancestral knowledge. So you might have more classroom training time. And I will drop the link for our training programs. And I would tell folks like, read up on all of them and see which one fits you best, what aligns with your values, what you're going to walk out with the same competencies, what aligns with your values. And then also be sure to ask before you sign up for a program, do you offer mentorship or hands-on training? That part is key. Even if you've had a baby yourself, practicing how to provide comfort, how to reposition someone, practicing those things with a doula who's been in the game for a bit will help build your confidence.
Okay, great. Thank you. So at this time, I do not see any other questions in the chat.
We have one more.
There's one question.
Just have one more question.
Is that the last one here?
It says, how can you find a doula in your area? And there's some more comments, but go ahead, answer that question first. How can you find a doula in your area?
So that's a great question. To date, we don't necessarily have a registry or a directory. What I hear very often is people will go online and simply search doula in my area, put in the zip code. Sometimes I will hear families say, I went online and typed in Black doula in my area. We are actively working to create a directory. So these are, if someone is paneled, credentialed with Medicaid, you can filter by zip code, by insurance. That's up and coming. But the best advice I could give you, if you can just do a Google search. Also, if you're active on social media, those are some of the best ways. You can look for doulas in your area and fill them out, ask them questions. How long have you been doing this? How many families have you taken? Do you work with if you're high risk, do you work with high risk families? What are your experiences? Ask them for references. I've had families ask me for references. Are doula services covered under most commercial? Yes, doula services are covered. So it's going to depend on your insurance. When you interview a doula, you're going to ask her, what insurance do you take? Because all doulas don't take all insurance plans, but yes, it's covered.
All right, and I do see another question that asks, would you recommend this training for a retired woman looking for a new career?
Absolutely. I told you, I go to my mama, my nana, and the church. You have a wealth of experience. You have so much to offer having lived life. I think it's phenomenal. And if you are looking to pivot, it gives you the opportunity to be independent, to be an entrepreneur, to build a new skill set. Like, don't count yourself out. Absolutely. I want you in the game. I want you training and supporting our families. Just because of your lived experiences, you have so much to offer to our families.
Right, and this will be the last question. And this question was actually for First Lady Boyer. When will the groundbreaking be for the Innovation Center?
That's an excellent question. We're looking for mid 2025 for the groundbreaking. Yeah, so thank you for that question. And just to piggyback on the doula, the one thing I neglected to say is that Mellon Maternal Wellness, the director for our birth center, she's a certified doula.
Wonderful. And I just have one of the comments from one of our guests here tonight. She reads, "This subject is very sensitive to me as I suffered with high-risk pregnancies with my 4 children in fear that I was not going to survive my labor twice. The programming center is excellent for women and will benefit from all having a doula. I had a doula 20 years ago, Linda Dika, and she helped me greatly. Not having one during other pregnancies, I fear for not only mine, but my children's lives."
Thank you for sharing that.
And Soria has dropped the information in the chat about the doulas, the doula training within the state of New Jersey. I'm wrapping the question and answer period here, and I am going to now pivot into our participant survey. I am going to drop the link for our evaluation. If you can take a moment to complete that evaluation here, it will greatly help us get some feedback about tonight's programs, any other topics that you would like covered in the next coming months, years. We definitely want to keep Black maternal health at our forefront. So this is not the last you hear of this. It won't be the second time you hear about this. This is a continuing topic and conversation, especially as both the Innovation Center and the Birthing Center are breaking way. We want to make sure that we bring all of our panelists back to give updates and to make sure that you're aware of what's going on within the city of Trenton, the county of Mercer, as well as the state of New Jersey, because we want to be innovative and step forward in the area of maternal health. So if you can take a moment to complete the survey, the link has been dropped into the chat. And with that, I am going to wrap my face on the screen and turn it back over to Sara Yasmin Lily Gonzalez.
Thank you so much. Thank you everyone for participating, and thank you Sora Bianca for hosting our question and answer portion. We are now going to, please, before we actually close out, we want to make sure that you do fill out the evaluation form, but we want to turn it over to our beautiful President Soror Morella, Dr. Morella Holmes. I think she's on. Thought I saw her. Yes, there she is.
Oh, good evening. Good evening. Thank you, Sora. Yes, appreciate you. Love you so much. First of all, thank you to the Physical Mental Health Committee and the Social Action Committee for putting this on and hosting such an impactful and informative webinar. We needed to hear this tonight, and we say thank you so much for giving your time and just putting your vision to action. First of all, during our May week, but also understanding that we have such a wealth of knowledge right here in the city of Trenton. I've known about the Birthing Center. I know it was coming, but to hear the legacy for which it is birthed from, it's phenomenal. And the fact that we have our very own First Lady, Tammy Murphy, it's just being a champion for us. Oh my goodness. It was just so wonderful. And thank you so much. Thank you to our very own Soror, Verlina Reynolds Jackson. We're with you. We're behind you. Thank you for being a voice for us in that space. We know how important it is, and representation does matter. And yes, you are not only the champion for your legislative district, but you're the champion for Black women in the state of New Jersey. And we're so proud to have you in that space representing us, but being true to who you are. And that is a woman of God, a woman of color of God, a Black woman of God. So we say thank you for that space. And of course, Councilman Yasmin Ellie, thank you always for how you use your resources to just position this sorority. Yes, I would say the best sorority in the country, because why? We're about social action first and foremost. That is what the first thing that we did when we were founded 111 years ago. We are about making change in our community. And I am just so happy that we've partnered and we're going to continue to partner. Thank you. You know, we cannot say enough about, Mount Zion. Thank you, thank you, thank you. We don't do this work alone. Delta we are founded on Christian principles. We understand, although we may wear red and white, but the hands that we are, we ask God to anoint them. The spaces that we in, we ask God to go with us. We ask God to be for us to be in those spaces and places to be what we are, and that's change. So I am so godly proud of everyone. This information was phenomenal. And I thought I knew something, but oh my goodness, I only knew this much. I only knew this much. And this is also very impactful for me because you all don't know my own birthing history of my first daughter. It was a very traumatic birthing experience for me. And I wish I would have had a doula in that space with me. I did not know at the time, but that doesn't mean that I can't champion for other women to have a doula present to advocate. And that's what it is, to be in the space to say, wait a minute, did you think about this? Did you think about that? The mother this, the mother that. Because my daughter she is 21 now, but I do know things would have gone very differently had I had someone in that space to advocate for me when I did not know. So thank you for this information. Thank you, everyone. We're going to do this work together. And I know, First Lady, you said when you don't have money, you organize. No, when you want to be impactful, you organize and you leverage your resources so you can have the greatest impact as possible. So listen, I cannot speak for the physical and mental health committee, but we are definitely partners and sisters in this body of work. And I look forward to the great things that we're going to have together as we move this platform forward and to bring more information to more communities. And thank you, thank you, thank you, thank you, thank you.
Madam President, can you please remind everybody to complete the survey?
Absolutely. So the survey is listen, we need for you to complete the survey to make sure that we continue to have impactful programming. We want to make sure what we do is meaningful to our community. The only way we can do that is for your feedback. If you like the information that was shared tonight and you want to do more, you want us to partner more, please fill out the survey. This is the way we can know that we are doing impactful work in our community. So please, please, please do it. We need it so we can continue to do the great work, not only of for women, but our community. Anything else I need to do, Sorry? Anything else? Just let me know. Let me know.
Thank you for closing out. Good evening, everyone, and we thank everyone for being here this evening.